All right, here we go with the flexors of the ankle and toes. This is on page 381 in your textbook. Right into the screen share. Flexors of the ankle and toes. So we have three more. We had three extensors, now we have three flexors, and they're very similar to the extensor counterparts. In this case, we have tibialis posterior, make that a little bigger, flexor digitorum longus, and flexor hallucis longus. These are going to be on the opposite side of the leg, of course, from the extensors. And these are not palpable because of their position relative to gastrocnemius and soleus. You can palpate the tendons, but that's about it. All right, so let's take a look at these. So here's tibialis posterior. It's right on the other side of the tibia from tibialis anterior. Flexor digitorum longus and flexor hallucis longus. And they look very similar, but they're on opposite sides, see? Flexor digitorum longus is on the tibia, flexor hallucis longus is on the fibula. This is a plantar view of the foot. It's just really weird. It's if this person was standing on their toes, that's the view that you would see if you were looking at the back of their leg. Just to give you an idea of what you're looking at. And you can tell that this is the bottom of the foot because there are the little sesamoid bones that are only present in the tendons on the distal end of the metatarsal there. Okay, so these are flexors, obviously, so they're going to be dorsiflexing, see, like walking on your tiptoes. But we're also going to have inversion and eversion as part of this package as well. And then, of course, flexor hallucis longus is going to flex the big toe, and flexor digitorum longus is going to flex all the toes 2 through 5, the digits. Uh-oh. Let's try this again. So we're on page 382 now. There we go. Here we are. So tibialis posterior originates on the proximal posterior shaft of the tibia and fibula and interosseous membrane. So it's basically the whole thing. Look, see? Proximal posterior shafts of the tibia and fibula and interosseous membrane. It's that whole thing in the center there. Or insertion is all 5 tarsal bones, all 5, and bases of the 2nd through the 4th metatarsals. So all 5 tarsals, these right here, and the bases of the 2nd through 5th metatarsal. So 2, 3, 4, and 5. So pretty big insertion, right? We're kind of a tiny muscle. Tibialis posterior, being on the posterior, like all of the other posterior leg muscles, are going to plantar flex the ankle. And tibialis posterior is also going to invert the foot. So tibialis anterior and tibialis posterior invert the foot. Got it? Okay. Flexor digitorum longus. There it is right there. So this one is the middle posterior surface of the tibia. It's pretty much exactly where it is, right? Middle posterior surface of the tibia. Because it is a digitorum, it is going to insert on the distal phalanges of the 2nd through the 5th toes. Just like its extensor counterpart, except this time, the insertion is, oh, the toes are crooked. The insertion is on the plantar surface. So before we had the insertion on the dorsal surface for extensor digitorum longus. For flexor digitorum longus, we have the insertion on the plantar surface. So of course, we are going to have flexion of the second through the fifth toes. Obviously, it's in the name. Weak plantar flexion of the ankle because it crosses that joint. And inversion of the foot. Inversion of the foot. And really the inversion is due to the placement of the tendon. Okay, so flexor digitorum longus comes down like this. Remember, it's going to cross here and insert right there. Okay, so it's going to pull it into inversion, which is this, inversion. All right, then flexor hallucis longus is on the opposite side. So this one's going to be on the posterior tibia, middle half of the posterior tibia, as a matter of fact. And then inserts on the distal phalanx of the first toe. Phalanx, as you know, is singular for phalanges. Pardon me. So this one comes down like this. Flexor hallucis longus. Weak plantar flexion, like the rest of them. Flexion of the first toe, of course, it's in the name. And inversion of the foot. So all three of these, all three of the flexors invert the foot, okay? Most of the ones that we've talked about so far invert the foot. The strong everters of the foot are those fibularis / peroneal muscles that we talked about. But like I said, a lot of the rest of the flexors and the extensors, actually, most of them invert the foot. So when in doubt, guess inversion. Just kidding, don't guess. All right. All right, so I had mentioned this before. We have these tape-like structures. They're not tape, obviously. They're connective tissue. Flexor retinaculum is here because it holds all the flexor tendons in place, you see? And we had another one across the top that was the extensor retinaculum. Retinaculum is singular, but as you saw in previous images, there are quite a few. So retinacula is the plural, right? Now, these tendons can easily be felt right through this area here around the lateral malleolus, which is the end of the fibula, as you know. Okay, so we'll be able to feel these right to about here. And then sometimes you can feel them into, you know, the big toe area, but not really. You actually have a lot of foot muscle that's going to be covering these tendons. Now, we don't go into a lot of the foot muscle. Okay, we just don't have time to do it as a group. And also there are so many that it would take its own unit, quite honestly. But you can see, look, all of this muscle on the bottom of the foot here. Okay, this is flexor digitorum brevis, right? We had flexor digitorum longus. There's got to be a brevis. What else do we have? Flexor digiti minimi. Aw, flexor digiti minimi just flexes the pinky toe. Abductor digiti minimi brings your pinky toe out to the side, abducts it. You know, most of these muscles are just names of the actions. Like, it tells you exactly what it does. And I don't need you to memorize these, but if you see this flexor hallucis brevis, you know what it does. It flexes the big toe. Here's that flexor hallucis longus tendon right there. Okay. This is another layer. This is a deeper layer. So there's even more muscle below the ones I just showed you. This right here is the flexor digitorum longus tendon. So there's muscle that's actually deep to that yet. These right here are called lumbricals. They are intrinsic muscles, meaning that they arise from within the body part that they affect. Most muscles that we've talked about are extrinsic. You have a quadratus muscle. Look, remember quadratus muscles look like rectangles? So here we are, quadratus plantae, because it's on the plantar surface. So again, lots of muscle in the foot. Whenever you're massaging the bottom of the foot, just try to visualize some of this. There is quite a bit. And of course, there are more structures here too. So here's even more muscle. Okay, and then all of the ligaments that hold all of those carpals, that's in the wrist, all the tarsals together. And of course, here are the arches that I mentioned before. Okay, so we're not going over specific muscles of the foot at all, but there's one structure, since we're talking about it here, that I do want to show you that is on page, actually it's on page 399, but page 404 is a better view. Let's do 404. The plantar aponeurosis. So the plantar aponeurosis, this thing right here, is also called the plantar fascia. This is thick, but fairly superficial band of connective tissue that runs from the calcaneus all the way down to the ball of the foot here. It is very important because it stabilizes the longitudinal arches, but it also helps stabilize the bottom of the foot in general when you're walking and standing. The plantar aponeurosis can't necessarily be palpated because everything in there is so close together, and this is just a superficial sheet of connective tissue. However, a lot of people experience pain in the bottom of their foot, specifically just anterior to the calcaneus here. And it's something called plantar fasciitis. And it's the plantar aponeurosis that's really affected in plantar fasciitis. So I wanted to show that to you because you're going to see people with plantar fasciitis quite a bit, actually. Okay, so that's what that looks like. And this is what gets inflamed in that disorder. Okay. This concludes the flexors and a little bit of the foot. I'll see you soon.